When patients wait in agony, someone has to decide, do doctors stay silent or fight for what they are owed? Nigeria's resident doctors have paused their strike after 5 days, but only on condition the government meets promises in 2 weeks. What's really behind this standoff, and can the FG get its act together? The Nigerian Association of Resident Doctors, NARD, has suspended its nationwide warning strike just 5 days in, with a 2-week ultimatum to the federal government to meet several long-standing demands. NARD began a 5-day warning strike across federal and state tertiary hospitals after previous deadlines passed without government fulfillment of key demands. What NARD wants, the core demands. Here are the outstanding issues the doctors insist must be addressed in the 2-week window. Payment of the 2025 Medical Residency Training Fund, MRTF, to members who had been excluded. Settlement of arrears from the 25 to 35% Consolidated Medical Salary Structure, CONMESS, review, 5 months of unpaid increases for many. Disbursement of specialist allowances. Daily trust. Restoration recognition of West African postgraduate membership certificates by Medical and Dental Council. Channels Television. The National Postgraduate Medical College of Nigeria should issue membership certificates to all qualified candidates. Daily Trust. Implementation of the 2024 CONMESS for all resident doctors. Daily Trust. Welfare and institutional problems in specific states, especially the welfare challenges in Kaduna State and issues at Lawtech Teaching Hospital, Ogbomoso. Government response. What's promised so far? The Minister of State for Health, Isaac Salako, has expressed optimism that discussions are progressing and some payments have already commenced, particularly for the MRTF for those previously excluded. NARD has acknowledged that the government has agreed to some of their demands, but the others remain in negotiation. The 2-week ultimatum is to ensure that promises are acted on, not just made. Impacts. What's been affected? Public hospitals, teaching hospitals especially, have been hit. Resident doctors do most of the frontline work, emergencies, theaters, wards. Their strike meant delays, reduced capacity, overworked senior doctors, and patients suffering. The health system under strain, with Nigeria already facing inflation, supply chain challenges, and poor funding for health. Every disruption worsens the situation for citizens who cannot afford private care. Why this ultimatum matters. This pause with a conditional ultimatum has several implications. It shows strategic negotiation rather than full confrontation. NARD is signaling willingness to wait, so long as action follows. The health crisis potential. Too long a strike could lead to catastrophic loss of life, especially for emergencies, maternal health, pediatric care. Government credibility is on the line. If FG fails to deliver within these 2 weeks, trust erodes further, not just with doctors but the general public. It sets a precedent. How public sector strikes, especially in health, are negotiated, how fast government responds, and how much of what is promised becomes reality. Risks and what could go wrong. Delay or non-delivery. The government may miss the deadline again, repeating a cycle of promises without follow-through. Partial compliance. Some demands may be met superficially, e.g. partial payments, but others may be delayed or ignored. Renewed strike. If commitments aren't met, NARD threatens to escalate or resume strike action, including indefinite strikes or solidarity strikes by state branches. Support for implementation. Funds must be released, administrative procedures cleared, oversight so payments reach doctors, not caught in bureaucracy. Bigger picture. What this tells us about Nigeria's health sector and governance. Chronic underfunding is still central. Issues like unpaid allowances, salary scale reviews, membership recognition speak to long-standing neglect. Fragility of health delivery. Resident doctors are crucial. Without them, emergencies suffer. Strikes show how little buffer the system has. Public sector bargaining is increasingly formalized. Ultimatums, warning strikes, negotiations. These may be becoming more frequent as inflation, cost of living, etc. squeeze workers' patience. Governance and accountability. How FG handles this could become another test case for whether government promises are implemented, especially amid so many other crises. What to watch over the next 2 weeks. Announcement of actual payments, MRTF, arrears, allowances. Action on certificate recognition and postgraduate college functions. State-level responses at hospitals like Lawtech and Kaduna. Whether state governments follow federal example or lag. Public health impact. Whether hospital services stabilize, emergency departments resume full capacity, no serious harm befalls patients. Final thoughts. Suspending the strike was a gesture of reason and compassion. Doctors want progress, not pain for patients. But the 2-week ultimatum is more than a pause. It is a test. A test for the government to show that promises can be kept, that dialogue has teeth, and that Nigeria's health sector isn't just a punching bag for politicians. For many Nigerians, the hope is that this time, things will be different. That this ultimatum won't expire into broken deadlines and more suffering. Whether FG can rise to that level is now under the microscope.
Thanks for watching. If you enjoyed this update and want to stay informed with fast, reliable news, don't forget to subscribe to Newsflash 360. Hit the notification bell so you never miss a story. Your next headline is just seconds away.